Hey, it's Mr. Shrum, and I'm just going to go through 1.1 Intro to Anatomy, terms of movement and orientation. This is a resource provided in the lesson itself, but it's flashcards with pictures, and hopefully this will help you understand how we refer to the body and where on the body we are talking about in reference to something else. Anatomical position, that is just our baseline. Here's the body. We divide the body into planes, as you can see here. That just makes it easier to refer to the body if everyone knows what part we're talking about. Sagittal plane, that divides the body into left and right sides. Sagittal, think sides, S for sides. Frontal plane, pretty self-explanatory. Transverse plane, that divides the body into an upper or superior, or lower or inferior part. So sagittal, side to side. Transverse is upper and lower. Superior, like we said, referring to things closer to the head, while inferior is referring to things closer to the feet. Proximal, that is when we're talking about a limb. So take, for instance, the arm. If we're referring to something on a limb closer to where it is attached to the body, that is proximal. So if we're talking about something near the shoulder, the limb is attached there, so that is proximal. And the opposite of proximal is distal. So if you're referring to something on a limb, like your arm, but further away from where it's attached, so if we're talking about the hand or fingers, that is distal. So referring to the arm, the hand is distal. Proximal, where it's attached. Distal, further away from where it's attached. Posterior, that is the back of your body. Posterior chain means the chain on your backside. Anterior, that is the front of your body. So ante, before, post, after. A lot of this Greek, Latin jargon. But medial, think middle, median. That is referring to things moving closer towards your midline, middle, median. Lateral is the opposite of median. So if you've ever performed an exercise like a lateral raise, for example, yeah, you'll have weights in your hands, and then you're gonna raise your hands outward, and that would work your shoulder. So lateral is away from the middle. Medial towards the middle, lateral away. Prone, that is when you're just lying face down, prone. Supine, that is when you're lying up. So face up is in supine. So supine means facing upward. Down, prone. Yeah. You're just going to have to get used to using these words more often. I think that's the easiest way to learn. Flexion, that is when we are bending a joint or decreasing the angle of a joint. See here, this arrow moving, she's bending the joint, decreasing the angle. But if she's extending her foot, she is lengthening the joint, straightening the joint. So if you're extending your foot, extension, flexion is the opposite. Flexing it towards your body and extending it away. Think of it like that. Adduction is when you are moving your leg towards the middle of your body. So towards, or not just your leg, but moving anything to the middle. That is adduction. Add versus abduct, moving away from the middle. And I would just like stand up and move your leg, just to make this like a physical thing. Move your leg towards your middle and say adduction, and then moving your leg away and saying abduction. But those words are very close together, so be careful. Elevation, it's when we're moving your body up. Depression, not that kind of depression. Depression when you're moving your body down, pushing your body downward. Medial rotation, as when we're rotating towards the middle, the midline, medial. So this person is rotating her leg inward towards the middle of her body. That is medial. Lateral, she's moving her knee away from her. So we're rotating away from the middle of your body. Pronation, so think prone, lying face down. Pronation, this person's hand is facing downward. The palm is facing downward and backward. So this is pronated. If you've heard of any, like a pronated grip, if you grip onto a bar and your palms are facing down and you pick it up, that is pronated grip. And if your palms are facing up, up is in the title, supination. If your palm's facing up, or any body part is facing upward, that is called supination. So pronation, down, supination, upward. Dorsiflexion, that is right here when you move your foot upward, flexing it upward. Moving your feet upward, flexing. And then plantar flexion is moving your toes away from your body. Moving your toes towards your body, dorsiflexion, plantar flexion, toes away. Okay. That is all for that part. I will do part 2 soon. So see you guys then.